So, Dr. Kelly, you do a lot of talks with groups of people, and you also have your private practice where you meet with individuals. Who seems to be most interested in learning about soul health?
To this point, I haven't had anybody who hasn't been interested, which is great. And granted, when people come to workshops, they sort of self-select to be there, so there's something about it that has drawn them anyway. But when I've worked with individuals in therapy, I meet them where they're at anyway. So there's different depths that people go to. But I've had workshops completely with holistic health providers. I've had nursing workshops I've done. I did a workshop about 1.5 years ago on the model to the North Carolina Dietetics Association about how to implement holistic care with this model into nutrition, and they loved it. So really what I'm finding, which is what I was hoping for, is that this really applies to anybody. You know, they don't have to have a particular spiritual slant on life because it's a human model that just happens to go deeper. And so people seem to be very welcoming and they embrace it, which has been really affirming and wonderful.
So it sounds like within the medical profession, the timing seems to be good for discussing and holding forth a holistic model that people can embrace within the profession. As individuals who come to you for psychotherapy, is there a readiness factor? Is there a moment that's, or is it the fact that they're there?
Well, and you know, that's actually a really good question too, because in the wellness field and in behavior change field, there's a readiness to change model. And really, this model, the soul health model, overlaps really well with that, because you can use this model when people aren't ready to actually make a change, but you can teach them about what they could be changing. So when they're ready to actually make the moves, things can really start popping. So this doesn't exclude anybody, because I think a lot of people take a long time to actually take action steps towards something. But that pre-contemplative stage, which is the first stage of change, where that changes model, is all about thinking about it. But sometimes when they look at the model and they realize, gosh, if I change this, then these things are going to change, they might be pre-contemplating it, in other words, thinking about it, but not ready. And that's why I think this model spurs people along, too, because then they start to become motivated and realize that, gosh, if I invest some time over here, this whole thing's going to balance out. So, you know, like any professional, I get people who really aren't really ready to change, but I get other professionals or other clients who come in and they're just ready, and then they jump into the model and they use it readily, they use it daily, they really embrace it. So this model fits really for any level of readiness. And what I've found with healthcare professionals is it's giving them a model to help them understand that, you know, they have 5-10 minutes to work with patients sometimes. But if they start to hone in on one particular piece of the puzzle, their patients start to move along a lot quicker. So it's not only giving individuals a framework, but it's giving healthcare professionals and also clergy, I work with clergy, to kind of look at, you know, chaplaincy or kind of the holistic health processes that they work with. So again, they can kind of conceptualize where their client or patient is from and help move them along. So really it can be used by professionals and individuals.